My name is Dr. Faraz Khursheed. I'm a board-certified neurologist. I have a subspecialty board certification in pain management, and this is what I mostly do. About 90% of the times I just treat chronic pain, but I see a lot of neurological disorders, neuropathies, headaches, spasticity, dystonia, migraines is a big one. So I have a broad range of patients that I treat. So you asked about ketamine. So ketamine is actually an anesthetic agent. All right, it's been used for many, many years, decades, as an anesthetic agent. People are put to sleep using this medication. But it is a dissociative anesthetic, which means that when you have anesthesia, it can also erase your memories. All right, so there's a big thing that, and an anesthesiologist can explain this to you better, that if you're having a big surgery under anesthesia, and if there is not enough erasing of the memory during that process, some people actually have PTSD-like symptoms after having a major trauma or major surgery. They have flashbacks of what was happening to them. So you control the pain effectively, you put them to sleep, but you did not erase those memories that are subconsciously getting built into their brain. Ketamine is something that erases that memory. So we took advantage of that and we started using ketamine at low doses infusions to people who had chronic pain, who had refractory depression, who had bad PTSD. So in those low doses, ketamine does not put you to sleep, so you're not completely anesthetized. You may be a little drowsy, but it has been known to completely erase some of the brain circuits that are formed in the brain when you have any chronic mental problem or any chronic pain. So it kind of just resets the brain circuits. It's given IV, so you have a IV cannula, and then you're connected to an infusion bag. You're connected to cardiac monitors to make sure that heart and everything is okay. But during the infusion, you're fully awake. You're talking. You can watch TV, play with your cell phone, do whatever you like, because it's sub-anesthetic dose of that medication going in. It goes everywhere in your body. Your liver and your kidney clears it from your body, but it's really the brain where it's working without you knowing about it, where it's really erasing the circuits and letting the brain reform the new circuits. And it has been really, really effective in treatment of a lot of chronic conditions, especially chronic pain. There has been a lot of studies to look at ketamine and its effects on chronic pain. It is FDA approved as far as I know for chronic pain treatment. And a lot of health insurances pay for it. And as you know that, if a health insurance is paying for a treatment, it is being tested and tried at various levels, at different levels of clinical trials. So most health insurances actually pay for ketamine infusion for refractory chronic pain. But some of the other indications, they don't pay for because there hasn't been enough level of testing for those indications. But as a matter of rule, if something works for one thing, it probably does work for something similar as well. It's just not been tested yet. So if ketamine works for, say, chronic pain by resetting the circuits in the brain, why wouldn't it work for PTSD by resetting the PTSD circuits in the brain? Or why wouldn't it work on chronic depression? We know that it's very safe and effective for chronic pain. So I think it's totally worth a try to do it, and then that's what people made people think that, okay, let's just try ketamine infusion on bad PTSD. People who are 5 different prescription medicines, still cannot sleep. War veterans, for example. So they tried this infusion, and then amazing results, incredible results. And there have been multiple small studies that you can find on PubMed and any other big studies database where it works for PTSD, it works for depression, headaches, severe anxiety, people who are suicidal, things like that. There is no set protocol. Now, since we are using sub-anesthetic dose and it goes in an infusion, at the center where I used to work at, we used to do 5 days infusion without any gap. So you come in every day in the morning. We used to leave the same IV until it gets infiltrated, and then you just get hooked up to that infusion bag, and then we just keep running it for next 6 to 8 hours. You go home, and then you come back next day. So we used to do for 5 days, and then reevaluate the situation in a few weeks' time to see if there is a need to do a reinfusion treatment or not. But most pain centers for chronic pain have the patients on maintenance regimen where they can get infusion for 5 days every 3 months and kind of just keep that level to keep improving the way the brain is processing chronic pain. because if you haven't removed the source for the chronic pain. If somebody has chronic pain from bad spinal stenosis, if they had a failed botched back surgery, you can't really fix that cause, but you can fix the way the brain is processing that signal.